Let's talk about some of the I'll call them myths or misinformation that's out there regarding vaccines. Um, can persons that are pregnant receive the vaccine?
Yes. Persons who are pregnant can receive the vaccine. In fact, I had pregnant friends who are nurses who were vaccinated.
Okay,
And we have healthy babies
perfect,
that have from vaccinated moms.
perfect. Is there any data that shows that the COVID vaccine can cause long-term effects or something like autism?
There are not. One of the more unique things about the mRNA vaccines, particularly the Pfizer and the Moderna, is that it really only stays in your system for 2 weeks, and then the vaccine is gone, your antibodies are there, but there's no evidence on for any bad outcomes on any of the vaccines.
Okay. Yeah, because I've had some clients express concern that they're afraid that something will happen um, in the long term that nobody has known about. And one of my responses has been, well, I think we're at around 183 million people in the United States that have, and I might be off by a few million, people who have received at least one vaccine dose so far, and they haven't detected like broad long-term effects.
There haven't been any, and worldwide over the billions of doses, and no broad long-term effects have been noticed. So yeah, I think the vaccines are very safe. I'm fully vaccinated, and my children, when it was their turn, were fully vaccinated. I felt very confident for the rest of my family to also receive the vaccines.
Okay. And so we're recording this, it's late August, it's August 27th, and the FDA, they've approved at least one of the vaccines.
So it's full approval for Pfizer vaccine, and Moderna was submitted to the FDA for full approval yesterday or the day before. So we do expect that to happen within the next 3 to 4 weeks. So those will I believe both will be fully FDA approved. Pfizer for 12 and up, and Moderna for 18 and up. And we will also the next step is then the booster shot.
Mm-hmm. Mm-hmm.
So those are coming as well.
Okay. And do you anticipate, regarding the boosters, that Heartland will be starting to distribute them at some point in the next couple months?
So mid-February was first shot, mid-March was the second shot. So 8 months after that, which would be mid-November.
Okay.
That's when we will be back to do the third shot. Okay. And anybody who had their vaccine with us, or if they're a participant of yours who had their vaccine elsewhere, will be eligible to get their vaccine at the appropriate time if they are a participant. We're also available as always, for any participants or volunteers. If there's any questions about the vaccine and vaccine efficacy, we're always available to talk.
Yeah, that was one of the things that I was gonna ask. What are besides the things that I've mentioned, what are some other concerns that maybe you've heard in your practice of people as maybe they've been thinking about getting it, but they haven't gotten it, and maybe they're still trying to decide on the edge of some of the issues that you've talked to people about?
So we talked a lot about people feeling like they're being experimented on, and people feeling that this is all happening very quickly. Mm-hmm. And really had a number of very intense, helpful, intense one-on-one conversations. And many people, after our conversations, my staff actually is all trained as vaccine ambassadors.
Oh, that's nice.
And so, we're able to interact and discuss the issues honestly, and provide scientific evidence of their efficacy, and respect whatever decision the participant makes that is best for their health.
Okay. What do you think is going to happen over the next few months in terms of the pandemic, and what our most effective healthcare response can be as we move into the fall?
I think that in the next month, we will probably see a peak of the Delta variant of this wave of the pandemic, this surge. And then in about maybe 4 to 6 weeks, we should see it start to wane. Whether there'll be another surge really depends on how well we vaccinate as a nation. And hopefully what I hope to see and what I've begun to see in some areas is that the number of people getting vaccinated is starting to increase. You know, we had some really high numbers at first, and then it started to fall. And I think the numbers of vaccination as a nation are starting to go up again.
Mhm.
So what I hope to see is more vaccine in that, as Dr. Fauci had said, that perhaps late spring we can start to see coming out of this. But it really depends on how many people get vaccinated.
Okay. So the general consensus from the healthcare community is that masks and social distancing alone aren't going to be enough for us to kind of put this pandemic to bed, so to speak.
They're not. It's very sad, but there's just not enough people who even follow the mask mandates, even when they're mandated. In the state of Illinois, we have a mask mandate for all indoor spaces. Many people don't follow it. And if everybody was following it, it would be fine, but they're not.